So, you've got an exam coming up on sensory disorders? Well, you're in the right place. We're going to treat this as our own high-yield study session, breaking down exactly what you need to know to absolutely nail this topic. Let's dive right in. Here's our game plan, and I've structured it for super easy recall. First, we'll tackle the major hearing disorders, then we'll move on to vision. After that, we get practical with the caregiver's playbook, and we'll wrap up with the core principles you have to remember. It's the perfect way to lock this info into your brain.
All right, let's kick things off with Part 1, Major Hearing Disorders. We're starting with the conditions you're most likely to see, the ones that really change how a person experiences the world through sound. These are, the absolute fundamentals for any healthcare exam.
First up, we've got otitis media. For your test, lock in these two phrases: middle ear infection and fluid buildup. That's the heart of it. It's often caused by bacteria or viruses, and you see it all the time in children. The result? Pain and some temporary hearing problems. Simple, but absolutely crucial to know.
Okay, now let's talk about Meniere's disease. This one is an inner ear disorder, probably from changes in fluid pressure. For any test question, you need to memorize this classic trio of symptoms. Vertigo, that's that really intense dizziness; tinnitus, which is a constant ringing sound; and hearing loss that kind of comes and goes. The three of those together, that's the signature of Meniere's. And this is a point I really want to drive home because it's so important for any exam. Hearing loss is never, ever just about not hearing. It has these huge ripple effects on a person's life. Like you see here, it can lead to social isolation, a lot of frustration, even depression, and maybe most critically, big-time safety risks. Not hearing a smoke alarm or a car horn, that's a life-or-death situation. Okay, moving on to our second section. We're shifting our focus now from the ears to the eyes. We're going to cover the major vision disorders you'll definitely come across, especially when caring for older adults. So, let's start with cataracts. The key phrase to tattoo on your brain is clouding of the lens. Simple enough, right? But to really get what that means for a person, we need a better mental picture.
And this right here says it all. This analogy is pure gold for your exams. Having cataracts is just like trying to see the world through a foggy or frosted-over window. This one simple idea immediately helps you understand what your client is actually experiencing.
Next up is glaucoma. With this one, the damage is to the optic nerve, and it's usually from too much pressure inside the eye. The single most important thing to remember about glaucoma is the slow loss of peripheral vision, your side vision. It basically creates this tunnel vision effect where the world just slowly closes in from the sides.
Now, let's contrast that with age-related macular degeneration, or AMD. So while glaucoma hits the sides, AMD goes right for the middle. It attacks your central vision. We're talking about that sharp, detailed vision you need to recognize a face or read a book. Knowing the difference between these two is a classic exam question, so make sure you've got it down.
And finally, diabetic retinopathy. The name gives you the biggest clue. This is a direct complication of diabetes. See, high blood sugar wrecks the tiny, delicate blood vessels in the retina. For anyone in healthcare, connecting a huge systemic disease like diabetes to a very specific sensory problem like this is absolutely essential knowledge.
Okay, so we've covered the what. Now it's time for the how. This whole section is about real-world application, the specific tools and communication strategies you actually need to use. This is where all that theory gets put into practice.
This slide basically lays out the entire toolkit, and you'll notice a pattern here. For hearing, we're either trying to amplify sound or we're using other senses, like touch, with things like vibrating alarms. For vision, we're magnifying things, making them bigger, or, again, using other senses, like hearing, with audiobooks. It's all about adapting to the specific challenge at hand.
This right here is a core skill. You need to know these steps by heart. Get their attention, face them directly, speak clearly, and notice it says clearly and slowly, not loudly. Shouting just distorts the sound and doesn't help. And if they don't understand you, don't just repeat yourself louder. Rephrase it. Use different words. The goal is clarity, not volume.
When it comes to vision impairment, safety and consistency are everything. You always announce yourself when you come and go. And please, don't move the furniture around. And remember these two key techniques you see here. The clock face method to describe a plate of food, like your potatoes are at 3 o'clock. And the sighted guide technique for walking safely. These are very specific, testable skills.
Now for a super important safety topic, service animals. The slide says it perfectly. A service dog in a harness is not a pet. It is a working professional. Think of it like a vital piece of medical equipment. The second you see that harness, your whole mindset has to shift from, oh, cute dog, to professional at work.
Let me be perfectly clear. These are not suggestions. These are hard and fast, non-negotiable rules for the client's safety. Any distraction, talking to the dog, petting it, even just making eye contact, can break its focus and put your client in real danger. You always speak to the person, not the animal, and you have to give them space to work together as a team.
We've made it to our final section. I want you to think of this as your ultimate exam cram sheet. If you only have a few minutes to review before the test, this is what you look at. These are the big ideas that tie everything else together.
And here they are, the 5 C's of sensory support. This is a perfect memory aid. You've got clear communication, a consistent environment, conscious awareness of your own presence, compassionate assistance, which means you always offer help, you never just assume, and finally, critical safety. Those 5 words, they basically summarize your entire job.
So, I'll leave you with this final thought to chew on. You now have all the facts, all the procedures you need to ace the test. But the real goal, the bigger goal, is to go beyond that. How can you take these rules and use empathy to turn them from just a checklist into real, genuine, human-centered care? Answering that, well, that's what makes someone a truly great caregiver.